No, no, this
I'm
for
looking for
us.
like a bedside table to kind of sit on. I guess they don't have one. But you want to take out the supplies and just literally sit them on the picture. So
So the silver bag that we get with the medicine in it, it goes in the refrigerator.
you can take it. I don't know if you have small kids and you have small kids.
No,
on?
no,
Okay.
just us.
Okay. You can leave it in the bag
smallest
because it
kid.
will be on ice, or you can take it out the bag and sit it, somewhere in the refrigerator.
And it's got to come out of the refrigerator 2 hours,
2 hours
before.
Okay. So if you're gonna administer at 10, then you need to
Take it out at 8.
At 8.
All right.
And whatever time of the day works for you. Just
Okay.
try to stick within the, that same, hour before, hour after time frame, just so you can kind of, create a schedule. But
Understood.
you literally want to. I'm gonna hold this up.
Okay.
So you can see. So it's just good to literally just place the supplies, it's alcohol swab, like, place it on the picture. It's a heparin flush, you'll sit it there, and you'll get 2 saline flushes and then your medicine will sit here.
Okay.
Prop it up so you can
Got it.
see. I normally lay it down like on a table, but okay, so this is what her medicine will look like. She will have 2 of these, 2 different medications. It's elastomeric ball. So you want to take this out of the refrigerator 2 hours before. Look at the label, make sure her name is on it and the medicine that she's taking. You want to make sure it's not leaking. If you see anything, abnormal leaking, or it got somebody else's name on it, which just don't happen. We just like to, tell you to inspect the medicine. Put that to the side. Get another one out so she won't miss a dose, and then call us about the one with the issue, and we'll take care of it.
Okay.
But the first thing you want to do is you want to take that cap off, like she had a cap on before they started that medicine. It could be green. The ones we seen you are turquoise. But you want to take that cap off, throw it away. It's good to have a little trash can beside because we're going to use it and throw it away. Take that cap off, throw it away. Get an alcohol swab, and you're going to swab her line. You're going to get an alcohol swab, and you're going to, let's pretend like this is her line right here. You're going to get an alcohol swab, open it, and just clean it. Throw it away. Now, the picture has 2 because some people have double, but she only has a single. So you just got to worry about one line. Then you're going to get the saline flush. A brand new saline flush out the pack. It have a little bit of air in it like that. You see? You want to push up till you see fluid at the tip like that. And then you're going to take her line because we already cleaned it. And you're just going to push in and turn. And that's push in and turn. I'm going to let you practice it. Only thing is, try to turn what you're attaching, because you don't want to turn her line and possibly get it out of place. So try to turn the flush. Yeah.
Okay.
Yeah, you don't want to turn and twist her line. It could possibly get out of
So
place.
this the line that's in her body.
Yes.
So I want to.
We pretending like that's the line.
Right. So then this is the medicine.
Yes, ma'am.
What's this in?
Well, a saline flush.
Saline flush.
Turn it towards you.
Okay. Try to turn this, not this. Okay. You
Okay.
want to? Oh, you
got it.
Okay. And so then you're just going to gently flush it. And flushing it just means you're just pushing this saline through, just slowly. See how I'm barely going?
Yes.
And you're going to do the whole syringe.
Okay.
When you're done, you're going to throw it away. After that, you're going to get another alcohol swab and you're going to clean her line. And then after that, you're going to get her first medicine. And we've already cleaned the line, so we're just going to push in just like we did with that saline flush, turn, and she's connected.
Okay.
Next thing, think of this as your start button. You just unclamp it and look, it's gone.
Okay.
And it'll run for an hour. And then when the hour's done, it will look like this.
Okay. Sucking in and all that.
And so she's on 2 meds, so the process will be a little bit different. So once that one finishes, the first one, you want to take another saline flush. Well, you want to clean it, take another saline flush, flush it, and then start her new ball, her other medicine. And when you're getting it out of the refrigerator, make sure you're taking one of each. So you're going to start her second med. That's going to go for an hour. When it's done, it's going to look like this. After that second one finishes, you're gonna get a saline flush, and you're gonna make sure you're always pushing up till you see fluid at the tip when you're flushing.
Mm.
You're gonna flush the whole syringe, get an alcohol swab, heparin. You're gonna take the heparin, it looks like this, and the pack is blue. And as you can see, just like the saline, don't want to come out. It has a little bit of air.
Mm-hmm.
You want to push up till you see fluid at the tip, and you want to flush this flush with heparin. This is only after you're done. When you're at the end. When you finish with your heparin, you're gonna put a new cap on, and you're done. Now, since hers is only one time a day, I recommend just doing them back to back so you can just be done. Instead of doing one in the morning, one at night, you can just do them back to back and just just be done. And the thing about it is she mobile?
No.
Okay, well, she don't have to be still because of this. It don't have to hang. It can go in your pocket. It can go in her moo-moo, whatever,
Okay.
It's pressurized. So once you unclamp it, let me show you. Once you unclamp it, it's going.
Okay.
If 15 minutes pass and you don't see any change in the shape, check your clamp. You probably forgot to unclamp it. And that's basically it. When you're flushing,
If you forgot to unclamp it, it's just sitting there.
it's just sitting there,
Okay.
and it's not a bad thing. But you want to go ahead and it's gonna delay you. You want to go ahead and get done, but it's no problem.
Okay.
If you're ever flushing and you feel like some tension, like it's not flushing, don't force it. Stop and call home health.
Okay.
Let them come out and look at it, because you don't ever want to force anything. You don't want to end up at the hospital, and it's painful.
Yes.
So call home health. Home health is your first line of defense. They have somebody on call 24/7. If she come out around, if she say she gonna be there at 10, whatever day she come, set the medicine out at 8 and let her watch you do it, or let her, do it. Or like I said, let her watch you do it. That way, give you that assurance
Yes.
that I got it. But once you do it one time, you
Yes.
don't.
Yes.
You just want to remember infection control. Wash your hands using gloves, hand sanitizer. We send all that. All you do is remove the cap, clean, get a flush, push up till you see fluid at the tip, flush the whole syringe, clean again, connect the ball. The first ball finish, you're going to clean, flush, start the next ball. When that last ball is finished, you're going to clean, flush with heparin, and put a cap on. And that's it. And like I said, if you lay this mat out and see the materials, and I know it's kind of awkward since she got 2 or whatever, so just remember after the first ball, you're gonna stop here and start the second one.
Mm-hmm.
And then you're gonna pick up from here and go.
Mm-hmm.
And you just want to remember to never push in air, never force, cover when she takes a shower, even a sink bath. Cover it with like saran wrap. That press and seal saran wrap works really well. You don't want to get it wet or anything. You want to keep it clean and dry. Always monitor for signs and symptoms of infection. Redness, puffy, swelling. If you see any of that, call home health or call a doctor. If you just feel like something's just not right, call home health. We do have a pharmacist on call 24/7 if you have any issues with your medicine, or if you can't get a hold of nobody, call us. We have, like I said, a pharmacist on call, and he can get a nurse on the line if he needs to. And that's basically it. I want to go over it one more time, and I want you to feel how this clamp feel. Because sometimes people struggle with like getting it unclamped. So you just want to put your finger here and just pull back there.
Okay.
Just like
Let
that.
me hold it and you do it, baby, because I know you probably
And-
gonna be the one, and I'm gonna be assisting you.
Steps 3 and 11. She don't have a clamp on her line. You see, she don't have a clamp on her line.
Mm-hmm.
So you don't even have to worry about 3 and 11. It's just saying if some people have clamps on there, she don't. You just want to just skip over that one and go to the flushing. But like I said, any flush you use, whether it's the saline or the heparin, push it up till you see fluid on the tip, and then flush. And we're flushing the whole syringe and throwing it away. Never reusing anything. I'm gonna let you get a full feel of that clamp.
Okay. So let me see.
Push
this
back
side.
here.
Back there. All right. And then.
Yep.
All right.
Yep. Okay, and then let me just let you get that. So you wanna push in and turn.
Okay.
And try to keep this line steady, cause like I said, her line you wanna keep it steady.
Sure.
And then push in and turn.
All right.
Yep.
See?
And then you just gonna slowly flush
Slowly flush.
it. Her dressing on her arm, on her pick line will need to be changed once a week. Home Health will change it. We'll send all the supplies. They'll be in a Ziploc bag. You can just give her that bag. She'll know what to do with it. And she's supposed to be changed every 7 days. If she not coming, if she coming on the 6th day, she need to change on the 6th day. But it's supposed to be changed once a week. And yeah, that's basically it. And then I guess she'll probably do her draw for her labs too, because she's on vancomycin, so she'll be getting labs done. Have they told y'all that? Okay, Home Health is gonna draw them. Okay.
They're gonna draw them from
From
the
our
pick line.
Mhm.
Okay.
From her pick line. Yeah.
Okay.
Do you have any questions?
Does this medicine that just, it works on the kidneys real bad or something? They're pulling labs for a reason.
Well, so they can check her trough levels. So let's see how I can explain this. How I can explain this. They're gonna check her trough levels because it has to be within a certain range for vancomycin. And the doctor looks at it. He looks at her values and sees if they need to like increase, decrease, hold it. Basically that's it.
I just don't know how much more fluid I need to make sure that she's taking in, or just try to just keep.
Is she on she not on dialysis or anything?
No,
No.
and I don't want her on it, and I don't want her. I
So
don't
she
want her
not-
sick. Period.
Right. She not on any fluid restrictions?
No.
Mm-mm.
Oh, I would think she could have as much, but that's a doctor question.
Well, she's normally a hard prick, so that's why I'm just figuring more medicine she needs to flush. More she pee, the better.
Right. Well, they don't have to stick her no more once that pick line in. We can do it. The medicine will go in there. They can draw blood from there.
That's what they told me, which I'm glad about that.
Yeah. As long as she got that pick line, they don't have to. And as long as it's being maintained, that's why flushing is important. The heparin is important. That helps keep the line open and padding.
I don't have anything that I could think of right now.
I think we're good for now.
And like I
We
said,
can always refer to the
Can
video.
we have it out too long? Like it's 10:30, so we don't start administering it till 10:40. Is that too long? Does it have to be like exact 2 hours?
okay, no. So as long as it's not like hot,
Yes.
cause I ask patients all the time, do you keep your house hot?
Yes.
And some of them like, no, keep it pretty cool. Well, if you do that, then, if you give me that 6 and you get up at 2 or 3 o'clock in the morning to go to the bathroom, go ahead and, and take it out long as the house is not too hot. And so I know, some elderly people, they keep it hot. My grandma don't keep it hot.
Yeah. They be
So-
cold.
Yeah, so, I mean,
We keep her room comfortable for her, but I just wasn't sure. I think we're gonna be all right. I just wanted to ask.
I definitely wouldn't have it sitting out, more than, 3 hours,
Oh, yeah.
if it's warm. But
Okay.
and then like I said, do the time that works for you. Even if you do it at noon, it's once a day, whatever time works for you.
Okay.
Yeah.
Okay.
And like I said, this mat, it'll come in your box.
Okay.
And, just lay it out and lay the supplies on the picture.
Sure.
And just pick up and go. And just like I said, you want to remember, maintaining infection control, wash your hands using gloves.
Yes.
Never push in air. You want to push up till you see fluid on the tip, and then flush the whole syringe. That's with saline and heparin. Never forcing. And you got it.
Got
And
it.
her mat will be more catered to her. It'll have the medicines and everything that we sent. Any special instructions from the pharmacist. It'll have her home health phone number and stuff there. It'll be more catered, it'll be specifically for her.
How new is this home infusion?
Okay, so our company has been open for a long time, our pharmacy. The infusion part, I wanna say maybe like 4 years.
Mm.
4 years.
Mm.
But I just started working here in December.
Mm-hmm.
But I'm telling you, sometimes I see 10 people a day.
Mm.
And we rarely get calls about issues because like I said, this mat breaks it down so much.
Yeah.
And then like I don't leave until I'm comfortable. And I've had situations where I'm like, they,
Mm-hmm.
they're struggling, they don't get it or whatever. And I've had to say, hey, I don't think they're a good
Well,
candidate.
that's good though.
Yeah, because the one I take it home, sometimes I be at home worried about, patients. So I was like, I have to say something. But that's why I don't mind people recording me. And like I said, it's fairly simple. IV seems scary,
Mhm.
at home
Mhm.
or whatever. But we do this every day. Like I said, sometimes I see 10 people.
Well, you have helped because ever since they said that to me, I have been awake. I think I slept a little bit.